Step 2, device instruction. Presuming the patient is new to the device, the actual instruction includes several steps. Introduction and purpose. Introduce yourself if necessary and explain the purpose of the visit. I find that taking a moment to add an additional comment about the importance of device technique is useful to set up this and future follow-up sessions. For example, people don't get the full dose of medicine if they don't inhale it just right. Or, because inhaling medicine is a little tricky, we are going over this with all our patients. Or, I want to be sure you are getting the full benefit of your medicine, so you breathe your best. Even with the session planning just described, it is wise to start by using universal health literacy precautions. An individual may have generally good health literacy, but struggle with a particular topic. Universal precautions means to always be prepared for patients who know nothing about a topic or will have more trouble learning than expected. A healthcare professional needs to be able to adjust to advance or lower the level of discussion based on the patient's baseline knowledge. Even if the patient's record indicates that this device has never been prescribed before, and it's possible they know something about it. Perhaps someone has given them information at the point of prescribing, or they may know someone that uses that device. To assess the patient's baseline knowledge, use an open-ended question. For example, show them the device and say, I didn't see in your record that you have used this medicine or a discus device before. I wanted to be sure that you have all the information you need. What do you know about this so far? Once you have an idea of what the patient knows, you can further tailor the session from there. If the patient has prior knowledge, and it is correct, the counseling process may be significantly streamlined. For example, if the patient already knows the dosage or purpose of the medicine, you can build on that knowledge. On the other hand, be prepared for initial misconceptions or concerns. Misinformation and concerns usually need to be clarified up front. For example, if the patient has just learned they have COPD or is concerned that steroid medicines are dangerous, they may be too worried to pay attention. Once their questions are answered or concerns put to rest, they may be interested in learning about the medication. A variation of the Indian Health Service Prime questions or Ask Me 3 questions can be used to assess baseline knowledge. If you are unfamiliar with the Prime or Ask Me 3 questions, check out our reference list for our sources of more information. The next step is to demonstrate and explain correct device technique. Presuming the patient has no prior knowledge of the device, this would be the approach. First, explain and then briefly give the rationale for each key step. For example, breathe out first so you can take a big breath and the medicine gets deep into your lungs. Notice I used the flip it communication technique. That is, explain what is to be done first, then give the reason for the action. Repeat this phrase. Breathe out first. It's what is to be done. So you can take a deep breath is the reason for the action. Here are some other examples. Be sure to blow out away from the device so you don't blow the medicine away. Hold the device totally level. By tipping it, you can lose the medicine. Wait 1 minute between puffs. This gives the first puff time to work and the second puff gets deeper. Hold your breath for 10 seconds so the medicine settles in your lungs. Otherwise, you might be blowing the medicine right back out. Explain each step and its rationale in terms appropriate for the patient's cognitive level and health literacy. The logic behind key steps is not obvious to the typical patient. Without this explanation and emphasis, a patient is likely to skip steps they think are unimportant. Once you've explained all the steps, demonstrate the complete technique cleanly without interruption. This way, the patient visualizes the timing, speed, and depth of breath and breath holding. You can do the demonstration yourself. Another option is to show a video. Most, if not all, of these devices have multiple free technique videos available online. Check YouTube, the website for the specific drug, or other internet sites. You can also use the patient demonstration companion videos to this series. Next is patient practice with feedback. Invite the patient to practice using a placebo device. Use the show me technique with a placebo device to ask the patient to demonstrate the technique back to you. After handing the patient the device, you might say, I want to be sure I covered everything correctly. Please show me how you would use it. Unless the patient is really struggling, it is best to encourage them if they are hesitant, but let them perform the steps without interruption. Watch their technique carefully and provide specific feedback with each attempt. Start by reinforcing steps they did correctly. Next, provide any tips for improvement. Remind them of any missteps. Invite them to try again. For example, the speed of your breath was really good this time. Notice we didn't hear the whistle on the holding chamber. But remember, it is important to hold your breath for a full 10 seconds if you can. Please try one more time. I will count with my fingers with you to help you see how long that is. Our experience is that 2 to 3 attempts with accompanying feedback are often necessary when patients are new to a device. Some might require several more attempts. When using a video for the initial demonstration, we don't believe it should totally replace interaction with healthcare providers. The video cannot replace your professional assessment of the patient's technique or provide feedback. Interaction with you also gives an opportunity for the patient to ask questions and voice any concerns. Key concepts can be emphasized and adapted to a specific patient's situation. Any health literacy issues can be overcome in order to deliver the information in a way that the patient can understand. Up to 30% of patients may not be able to use an MDI despite multiple attempts and instruction. A training device, such as the two-tone trainer or an in-check dial, may help when the problem is the force of the inhalation. If the device is a metered dose inhaler, perhaps a holding chamber might help if the problem is the timing between device actuation and the breath. Adding a holding chamber with a whistle may also help if the problem is too rapid of an inhalation. If problems remain despite several attempts, for example, a patient is unable to perform some key step, consider selecting a different device with the same or similar medicine. Provide written or other educational materials. After adequate practice, provide the patient with a written technique tip sheet for the patient to take home. Correct technique requires multiple steps, up to 10 to 15 steps depending on the device. So a written reminder is useful. Written instructions alone have not been shown to be effective in teaching technique, but adding written instructions to verbal instruction has shown to improve retention. The tip sheet can be used to emphasize steps, needing additional practice by underlining or highlighting these steps on the tip sheet. Supply them with reference information suitable for their health literacy level and preferred learning method. Commonly, this is written instructions, but a website or online video may be preferred. You may have picked out an initial resource prior to the counseling, but adjustments might be needed after your interaction with the patient. Encourage patients to review the instructions before taking the first several doses to remind them of all the steps. For some patients, you may suggest they observe their first doses in front of a mirror. The mirror can help the patient see how they are holding the device. If they observe the spray coming out the sides of their mouth, they can know the timing of the inhalation to actuation is off. Provide additional necessary information about the medication. Information to include are the medicine dose and frequency and common or serious side effects. Review the medication dosing regimen. The patient knows when to take the medicine. Consider how to best integrate the medicine into their typical activities. Explain how to avoid common unwanted effects, such as the thrush from corticosteroids or dry mouth from anticholinergic agents. Patients also need to know what to expect from the medicine. For example, is this a controller or reliever? How long will it take to notice a benefit? Based on their specific situation, what specific benefits should they look for? For example, less cough, fewer nighttime awakenings, etc. Replacement of the device storage and cleaning instructions vary by device, so should also be included. If the device has a dose counter, point it out. Discuss when to request refills based on the number of doses remaining. Knowing how many doses are contained will help them estimate how frequently the medicine needs to be refilled. This additional information might flow naturally at either the beginning or end of the session. It is very important to check a patient's comprehension of the information presented. Patients should repeat key information in their own words. Non-responses like "yes, I understand," a head nod, or a lack of questions is not enough to presume understanding. A teach-back technique is helpful to assess understanding of facts like dosage. Teach-back encourages patients to repeat key information and for us as healthcare professionals to accept responsibility for the patient's understanding. So I can be sure I was clear. How will you take this medicine tomorrow? Sometimes patients will already have repeated some content as part of the normal conversation. In this situation, use your judgment about whether or not teach back on this information is still necessary. At closure of the session, summarize key points. Ask what questions the patient has rather than if they have questions. This gives an indication that you are open to and expect them to have questions. Also, include an offer of further assistance if needed in the future and a time frame for follow-up. The interval for follow-up depends on the level of difficulty the patient had learning the technique and disease severity. If you are counseling from a pharmacy, the logical time is at the first refill. You might include a comment that you will ask them to demonstrate the technique again at a future visit. Modifications. This framework just outlined is for typical new device instruction. It assumes that there's little or no prior knowledge by the patient. Some modifications of this framework would be appropriate based on patient's prior knowledge and skills. If the patient has used the device before, or this is a follow-up from a previous visit, you might, after the introduction, go right to the show me portion of the session. For example, Mrs. Jones, last time we talked about how inhaling the medicine just right is so important. I want to be sure you are receiving the full benefit of your medicine. Please show me how you have been taking your medicine at home. After asking them to demonstrate, observe their technique carefully. Pay special attention to any steps they struggled with at past visits. Similar to initial instruction, provide them with feedback both in areas to improve or confirm correct steps. You might offer the patient another copy of the written instructions. On the other hand, if this is a new device but the patient had used a similar device before, you might point out the similarities and differences of the new device to the previous one. This portion of the counseling could sound like this. This device is very similar to the one you were using, but there are some important differences that I want to point out to ensure the best results. Reassessment and repetition over time are needed for long-term retention of good technique. In general, up to 80% of verbal content is forgotten as soon as the patient leaves, and nearly 50% of what patients do remember is recalled incorrectly. In one study, up to 50% of patients performing device technique correctly at the end of initial instruction will have inadequate technique as little as 1 month later. Reassessment and repetition are necessary for correct device technique to become habitual and sustained. Even for patients who demonstrate excellent technique on initial instruction, require follow-up. The ideal frequency for reassessment is not known. The asthma guidelines have suggested checking device technique at each visit. However, checking this often may not be practical in every practice and for every patient encounter. Repeated assessment of device skill is especially important with the first few refills. We suggest making it a priority to recheck at the first visit after initial instruction. If possible, continue to check at each visit until correct technique is sustained between visits. Then, cut back to checking every 6 to 12 months, as long as good technique is maintained. However, use your judgment. If a patient is returning shortly afterwards regarding a different problem, we might skip checking at that visit, especially if the recent technique has been adequate. In addition to the standard follow-up, there are additional prompts to alert a healthcare professional to recheck a patient's technique. Patients who appear struggled with multiple steps, are less confident, or have more severe symptoms should be checked sooner and more often. If the patient's asthma or COPD remains uncontrolled, despite patient-reported adherence, their technique should be reassessed. Poor device technique and resulting inadequate drug delivery may be the cause. Perhaps patients are continuing to use an empty device. Also, reassess technique if an adverse reaction is reported. For example, the patient may not be rinsing their mouth following use of a corticosteroid. If the drug profile shows non-adherence or says the medicine is not working, the patient's technique should be rechecked to see if poor technique is limiting efficacy. Finally, when the patient is picking up refills, check previous documentation regarding technique to prompt you to follow up on issues from the previous encounter.